43 past the hour. There's a good chance that this holiday season you will be exposed to, well, a series of viruses spreading fast this season, including a surprising surge of walking pneumonia. Many of those cases spotted among children and teenagers. Joining us now is MSNBC medical contributor Dr. Vin Gupta. Doctor, it's always a treat to see you. I thank you for your time. What exactly is this walking pneumonia?
Well, Jose, happy Thanksgiving. You know, walking pneumonia is really what it's what it sounds. It's a pneumonia. It's basically a bad cold, but it's not and it causes a pneumonia, but it's not so bad that it causes you to stay embedded throughout the day. So you can literally walk with it and function. And so that's why they call it walking pneumonia. That Z-Pack that many of your viewers might be familiar with, Jose, you may have taken it in your life. I know I have. That 5-day course, that's usually the treatment for walking pneumonia caused by bacteria that we don't really talk often about. But this is something that we've been seeing more and more since the pandemic. Usually a bacteria that has sprung up maybe every 3-4 years, especially in a pediatric population. But we're seeing these trend lines now more and more. And Jose, it's reflective of the ways in which COVID has really changed the ecosystem of bacteria and viruses that we inhale. Things are really unpredictable these days.
So COVID is a virus. This thing is a bacteria. How do we know that we have, walking pneumonia and not a really bad cold? Or even, there's some kids that are able to, walk around with some sniffles or cough, et cetera, and they don't even know they have it. Yeah. What is the difference? How do we know the difference? And what are the treatment differences?
Yeah, absolutely. Well, these are such the critical questions here. Here's the issue. There's over 200 human respiratory viruses that exist in the air around us to varying degrees. There's many more bacteria as well. And so the answer is it's just very hard to tell based on your symptom profile because the symptoms mimic each other across viruses and bacteria that you inhale. Here's what to do. If you're a parent at home and you've been hearing about this, you've been seeing children that go to, say, school with your kiddo getting sick, what you really want to do is present to your pediatrician if your child is not getting better after a few days, has a high fever, say over 102, difficulty breathing. Those are the things that should definitely prompt medical attention. Short of that, if you're worried, well, is this cold or the sniffles, walking pneumonia? Really, it's about severity of symptoms and whether they'll clear it. That's high level advice. I'd say anybody that's concerned should speak to their medical provider. I should also note, though, Jose, for the adults especially that are watching, those that are medically higher risk because of age or an underlying condition, we now, for the first time this year, have COVID flu over-the-counter at-home tests that can test for both COVID and flu at the same time, which is important because, as you know, COVID has its own treatment, flu has its own treatment, and the earlier you start it, the better to keep you out of the hospital. So now we have better tools at home.
Well, that's so important because I've seen those flu and COVID tests, but are they effective? Are they actually better than or not than getting just a COVID test and then, a flu test?
The problem is the flu test standalone doesn't exist within the at-home environment. So this is that sort of 3-in-1 test that only exists that would allow you to test for flu, even though you can also test for COVID. The sensitivity of these tests, the accuracy of these tests is very high. So no different than just the COVID alone test. So I'd recommend everybody stock up if you can. There's actually some Black Friday deals. Not that, I have sort of any inside road here, but I saw some discounts today on Black Friday. So you can get them on the cheap. You can submit the receipt to your insurance, hopefully for full reimbursement. Or if you want, you can go to covidtest.gov to get 4 free COVID-only tests delivered directly to your house. So either way, I would arm yourself with some of these tests so you're aware. If you're somebody that has a medically higher risk condition, though, Jose, what are the other things you can do to stay safe? Make sure you stay up on your refills. Everybody asks me as a pulmonologist, what can I do, doc, to optimize my health? 30% of Americans don't stay up on their refills. And that's a bad thing, especially if you're traveling. Hand hygiene is critical. Obviously, it's not too late to get the vaccine, but these are some of the things to stay healthy and have a plan with your provider. Make sure you have a plan with your provider if you get sick.
This is so important. I thank you, Dr. Vin Gupta, for being with us today. Really appreciate it, my friend.
Thank you.